Good afternoon. I'm Travis County Judge Andy Brown. I want to thank everybody for being here. Thanks to my Commissioner's Court, Sheriff Fernandez, Community Care, and others for joining us here today, as well as our research team and Dr. Walks, our health authority. Today we're just here to share some highlights from the Justice and Planning staff and the research that we had asked them to do. It outlines how many people died of an accidental overdose in our community after spending some amount of time in our jail, and what other key indicators that can help us identify what makes people at higher risk of death by accidental overdose in Travis County. So the Travis County's Justice and Public Safety Data and Research Team conducted a comparative analysis of the 417 accidental overdose cases from the medical examiner using data on homelessness, mental illness, and jail records. That analysis indicates that 89 of those people were in custody at some point between January 2021 and December of 2022. And this is definitely data that's worth digging into because there's a lot missing from it, but also a lot that we have learned from it so far. In Travis County, just like nationally, being homeless, having an unmet mental health need, or being incarcerated are key indicators to whether you are at a higher risk of accidental overdose death. So we had the JPS team use that data to identify key indicators for high risk of accidental overdose death. And here's what they found. 89 of the 417 accidental overdose deaths last year were of people who had been in jail at least once in the last 12 months before they died. Some of those had been arrested multiple times, and maybe even before that. Statistically, what that means in Travis County is that a person's 8 times more likely to die of a drug overdose in the first 12 months after leaving jail than everyone else in the county. 8 times more likely to die. 27%, or 24 out of those 89 people who died from an overdose received some mental health services while in jail. The data also shows that a person who enters the jail is at the highest risk of dying from an accidental overdose death in the first 30 days after they leave the jail system. It's also clear that this is happening to a broad group of people. In terms of age, people 31 through 40 make up the biggest demographic of these deaths, followed closely behind by people aged 41 to 50. All of these are preventable deaths. And one of the ways that we can help stop this cycle is by helping divert people with mental illness or substance use disorder who don't belong in jail, but rather need access to support services. We can also make sure that when people leave jail, they're connected to a healthcare system, connected to peer support specialists that are informed by harm reduction practices. So making sure that community care, Central Health, any other providers have more of a warm handoff after people leave jail, whether they're in jail for a day, an hour, 2 years, anything like that. We want to make sure that there is a warm handoff to care, mental health care, substance use, medically assisted treatment, injectables, things like that. I really want to thank Sheriff Fernandez, who, along with our partners at Community Care, got a briefing on this last week, and we've been talking and working through kind of what this all says and what the next steps are since then. The sheriff is doing a tremendous amount of work to help the people who the jail serves by connecting them with resources inside the jail and when they leave the jail. She's working to expand access to naloxone to people in our community by giving it to people as they leave jail. The big picture today is that today's report is, I think, a first step towards a better understanding of key risk factors related to drug overdose deaths in Travis County. We saw that number increase from 21 to 22, and we are wanting to do everything that we can to look at all the touch points that people have with their county government to see what can we do better in terms of preventing those accidental overdose deaths. So I'll now pass it over to Commissioner Gomez.
Thank you so much. And I'm very proud that we're taking this step to find out a little bit more about what we can do to help people who are in danger of losing their life. I think we're going to take the information and consider what the messages are in the report for us so that we can take the proper steps to save lives. And in addition to that, I think it's important to also accent the fact that it is so important for families to have health care from the beginning of life, to learn how to take steps to be healthy in every way possible, and so that none of the actions that we take will lead to death. And so we hope to be able to get that information out as well to everyone in Travis County. Thank you.
Thank you, Commissioner. Sheriff?
I guess I can stand up here too.
Sure.
So as we analyze, thank you, Judge Brown and Commissioners. As we analyze the numbers in the medical examiner's report, we're even more committed to the collaborative approach in putting a stop to the deaths that were highlighted. The reason people use drugs vary one to another. It can be chronic pain, mental illness, or addiction. Just to name a few, assessing what kind of situation we're dealing with can be extremely challenging in the jail, especially when they're caring for someone who, when they come into custody for just a short time. Most people coming into central booking are not forthright in revealing their drug usage, and because of their criminal charges, which complicate our ability to help them with a plan for recovery. We know that detox is vital to the rehabilitation process, and detox takes a minimum of 5 to 7 days. Many people in our custody will bond out before they've had the opportunity to fully detox. In fact, of the 89 people who died of overdose after being in custody, 31 suffered their deadly overdose within 60 days of leaving our facility. More than half of them were in custody less than 10 days. Many of the people that we see in our facilities have histories of inadequate health care. They often have very serious medical conditions, sometimes in addition to their drug addiction. In an effort to save lives, TCSO has been distributing Narcan, starting with our patrol staff on the streets since 2018. In 2020, as the product became more available, we began providing Narcan to people both at Del Valle and at our downtown location. We experienced a lower supply level during the pandemic and had to limit ourselves to distribution in Del Valle only. Now that our supply continues to increase, we're reinstating our offerings at Central Booking. When they leave with Narcan, they're getting more than just the medication. They receive instructions and a resource guide. The directions demonstrate how to administer Narcan to someone else. And the vast majority of the people who are using drugs containing fentanyl are doing it alone. Narcan cannot be self-administered. Narcan is vital for saving lives, but it's not in itself the solution. As we continue to look further into these numbers, the value of collaboration with our partners like Community Care, Central Health, Integral Care, and the criminal justice system as a whole is vital. Expanding the resources available to individuals leaving custody and better connecting them to ongoing services to sustain their recovery is what will make a difference and save lives.
Thank you, Sheriff. Up next, we've got Dr. Nicholas Yagoda. Do you want this?
It was just easier than...
Good afternoon. Thank you to Judge Brown, and thank you to Sheriff Hernandez as well for convening us today and to share your findings. Thank you most of all for asking the important question about how drug overdose is affecting our community, particularly those of us involved in the justice system. Again, my name is Nick Yagoda. I'm a physician and the Chief Medical Officer at Community Care. I'll take the next couple of minutes to highlight 5 interventions or services to address what's been presented. First, out of the gate, we note that these statistics are people who died and people who leave behind loved ones. In any next step, we need a space to mourn those from our community who we've lost. Second, medicines. Medicines for opioid use disorder save lives. Among those, naloxone, as Sheriff mentioned, has reversed countless overdoses in our community already, but how do we expand access further? Last year, Community Care joined advocates on the national stage to work with the Health Resources and Services Administration of the federal government to successfully modify policy to increase access to naloxone through community health centers. Here in Austin, our goal should be widespread naloxone uptake and distribution to a saturation point. By boosting the number of people who carry, use, and refill naloxone, we will reduce overdose deaths. This will require equitable access to care, including life-saving medicines beyond naloxone or Narcan, such as buprenorphine, methadone, naltrexone, and this will require equitable access to health care coverage. But we have surmounted barriers like this already. As an example, the partnership between Central Health, Integral Care, and Community Care years ago helped to dramatically expand primary care-based substance use treatments for our community's uninsured and most vulnerable. Access to medications to treat opioid use disorders has only expanded since then in all manner of clinical settings. By expanding existing partnerships and bridging new ones, inclusive of medical care, behavioral health, criminal justice, shelters, harm reduction coalitions, and more, we can build a stronger safety net as people transition from one setting to another. Third, stigma. Stigma perpetuates the epidemic of overdose deaths. Addiction is a chronic disease that can be managed as we do other chronic conditions like hypertension or diabetes, with medicines and behavioral health support. When treated, opioid use disorders most often get better. People can flourish when they have access to low-barrier, non-judgmental, comprehensive care. Community Care is one of just a number of providers in the area offering this approach. As a community, we can expand stigma-free services. Fourth, harm reduction. Much of this death is related to a poisoning of the drug supply. To prevent deaths, it's imperative that those who use drugs and those who seek to keep them safe know what drugs we're dealing with and how to use them safely. We can work together as community members, health care professionals, law enforcement, and all levels of government to assemble evidence-based harm reduction tools to keep our community safer. And fifth, those with the lived experience are poised to help lead this response. This model would anchor everything we do towards the needs of the community themselves. From this basis, we could devise broadly conceived, community-based harm reduction responses that uphold the dignity of our vulnerable neighbors who use drugs. Again, I commend Judge Brown and Sheriff Hernandez for their leadership and collaboration and for Drive for a Better Way. Thank you.
Thank you. Up next, Dr. Walks, our Health Authority. Thanks.
Hello, my name is Dr. Desmar Walks. I'm the Austin Travis County Health Authority and APH Medical Director, and I want to start again by thanking Judge Brown, the commissioners, and Sheriff Hernandez for calling us together today to speak on this very important subject, the loss of lives in our community due to drug overdoses. The work that's been done in gathering this data is something that's been ongoing, and it's been the result of a collaborative work that spans across the healthcare continuum, criminal justice continuum, public health, et cetera, to come up with ways that we can work together to identify points in time when people are seeking resource assistance, and if they, at that point in time, feel safe to divulge that they're having an issue with substance use, that data can be gathered, shared with the appropriate harm reduction treatment providers in our community, and plug people into care before it becomes a death sentence. This data that we're reviewing today is very poignant and very pointed, both for our criminal justice system and for our healthcare system, as it elucidates the problem that we have in that first 180 days post-release from whatever length of time they happen to be in the criminal justice system. And as such, it's going to help us at Austin Public Health deploy resources where they need to be deployed to those who need to have the help. I want to reiterate some of what Dr. Yagoda said, in that we are about getting naloxone, Narcan, into the hands of people in our community so that they can save lives. As the supply increases, the distribution will follow suit. And we are working together, both county, city, and all parts of our community, to make this a reality. We're also using dollars that we've acquired through grant funding and other sources to increase the number of peer support providers that are in our community, and to support our partners such as Community Care in their efforts. We're also working to improve our data sharing so that in the end we can do a warm handoff and share the data that will help clinicians provide the care that they need to for our citizens who are suffering and dying. And with that, I'll pass it back to the judge. Thank you.
Thank you. Commissioner?
I appreciate the leadership that is asking these questions. It is really important for us to have a deeper understanding of the factors that are contributing to so many people dying from opioid overdoses. But I want to stress it wouldn't be the correct understanding to take away from this data that incarceration causes this. It's one of the factors that is associated with people who die from drug overdoses. But I think the really big message is there is a huge need for additional services for people who are struggling with addiction, and especially when they get released from jail. One of the really surprising statistics is that 40% of those who died, who were released on personal recognizance bonds, died from drug overdose. We clearly need to do more to help people when they are released. And I really look at the state. They have a $10 billion surplus. The governor said that mental health was going to be a top priority. There's clearly an overlap with mental health issues as well, and I would just urge the state to invest more in providing care for people when they're literally dying because they don't have access to that care. Thank you very much.
Commissioner?
Sure, real quick. Thank you, Judge, for your leadership on this. I just wanted to underscore that I don't know about your family, but in my family, addiction's been really mean. And addiction, you can't just drop your addiction because you got arrested or because someone told you so. And so we have to do everything we can to have treatment available, to have medicines available when someone's ready, when someone says, I need help. It's got to be available then. So that's 24/7. It's all around the county. It's in jail and it's out of jail. We are committed here to jail diversion because we know that too many people battling mental illness are suffering in jail. And I think this data underscores that yet again. So, Judge, again, thank you for your leadership on this. Thank you, Sheriff, for being a trusted partner in the work. And let's keep doing the work. Thank you.
Thanks. So I think that's all the speakers today. I just want to recognize again Valerie and her team that work with Vicki Ashley. Where's Vicki? There's Vicki, who's the county executive over Justice Public Safety, Justice Planning.
Justice Planning.
One of these days. We're, I think, going to rename this organization soon. But thank you for doing all this hard work, and just open it up if y'all have any questions for us or for Valerie or any of the doctors that are here. Yeah, hi. You got this?
I got it.
All right, thank you.
Hi, thank you for your question. I'm Valerie Ollier. This is my report. And alongside my team, I'm the one that analyzed this data. So to respond to that, we focused on 2022. That's what we were asked to do specifically because it was such a trend. The number of accidental overdose deaths increased so much in 2022. So no, we don't have any of that data pre-COVID, but that's something we're working towards. And just to kind of piggyback on that response, this is very much a seminal study, and I think Judge Brown wanted to get it out to the community and just start having these conversations. This kind of data merge is really complicated. You're working with the medical examiner's data, you're working with the jail booking data, you're joining that data, and that takes time. And the data that we have in this report is just the beginning, so.
Sure.
National data of other cities of similar size to see if this is a nationwide trend or Travis County trend?
Great question. That's something I spoke about in court, is that this is a nationwide trend. And for instance, Vera Institute just put out an article that cited a Washington State study saying that individuals are 129 times more likely to die after they experience a jail stay, die of an accidental overdose after jail stay within the first 2 weeks. So that is something that we looked at, and yes, that's what we're modeling this study after.
And did you all, backing off of that, did you all get solutions at some of those places and implemented them and sort of take those into consideration, and that would be a Judge Brown question?
I believe that would be a Judge Brown question, or any of the other doctors that would like to step in.
Yeah, I think if you want to, so last week we got a briefing with the sheriff and with Community Care, Central Health, some other folks were there, and there were a few things that I think Community Care had as kind of good first steps. The biggest one to me is that, again, whether people are leaving jail after 2 hours or 2 years, we need to do a better job as a community in providing the services that Commissioner Shea talks about. We need to make sure that we are giving people injectables that are longer lasting. We need to get people on medically assisted treatment, what the sheriff is doing, but continue that as they leave. For people often lose their health coverage if they had it when they go to jail. We need to make sure that we're continuing that we're not relying on them after they get out of jail to go figure out how to sign up for it again, especially if they're indigent, but to make it to where Community Care or others are enrolling them maybe before they leave, keeping them on that health care coverage. But Doctor, do you have any other thoughts?
Thanks. So great question. Understanding what it takes to support folks with addiction seeking recovery. It's very complex. There are medicines. There are a lot of social support that needs to come into this as well. So to what has been mentioned already, it's taken the healthcare system writ large a substantial amount of time to be able to adequately respond to get access just through traditional healthcare systems. Some of our excellent partners at the Dell Medical School and Dell Seton Medical Center have started access to care through for hospitalized patients. That level of integration into entities that do healthcare professionally is a substantial lift. To ask that be integrated into the criminal justice system is a real innovation. And it's something we can do, but something that jails were not originally designed to do. So how do we look at the recovery process for those who are incarcerated and integrate the medical care along the full continuum of care, from the diagnosis to linking to care, to getting them on meds, to getting them into some sort of stable circumstance where they can ensure long-term adherence to those medications? It's a very complicated process for populations who are already encumbered with a number of different barriers, not the least of which is stable housing, jobs, et cetera. So there is integration to medical practice within the criminal justice system. There is immediate or seamless handoffs to high-functioning substance use support systems, both the medical side and the wraparound behavioral health side. And then there is innovating with, and Judge Brown mentioned this a little bit, there are medications that can help us bridge those gaps. Most of medications for treatment of opioid use disorders require daily dosing. There are some that are available on a more limited basis, usually because they're cost prohibitive, that allow for instance, injectables that would allow for a duration of a therapeutic dose over the course of many days that would allow us transition without significant risk of disruption of that therapy. So there are a number of different approaches that have been established through demonstration projects like those in the state of Washington that we could certainly apply here.
This is a question to the Sheriff's Office. Are there people or services following up with folks who leave jail that have drug addictions? And if not, is there a plan in place to potentially provide that in the future?
So what we have been doing and what we're actually, after we looked at these numbers, we're going back because of the length of stay that they have. So if we have a plan for somebody that stays less than 3 days. We have a plan for somebody that is there, less than 10 days. And for those who have a longer stay, we have counseling, we have a mental health and a programs, where they have access to counseling. So we're looking at what we do internally, but I think what this data has highlighted and is showing us is just how much more we need to do with our partners, right? And doing what the judge suggested, that handoff. How can we help them leave and get connected and have resources after they leave the jail? So
just following up, so at the moment there are no resources for someone who were to leave jail and need mental health services?
no, they do get resources when they're leaving the jail. Yes.
Follow up just on your thing. The other thing that when the sheriff and I were talking about this data that hit us is that some people obviously are in the jail for a very short period of time, and it's hard to then sort of figure out, do they have an addiction? Do they have a mental health need, and have the time to get into that and work with them on that? And so that's something that a mental health diversion center would help, because one model, at least in Nashville, of the mental health diversion center is even if they get arrested, even just for a low-level crime, they will then go to the diversion center for a period of 14 to 30 days. So that would give the time to actually start giving people help and assistance, getting them stabilized, getting them on meds, getting them into a stable housing situation afterwards, that currently we're not offering.
Some of those short-term solutions,
Yeah.
the naloxone, the medications, are you coming back to the deadline to say, we want to come back and look at this and determine if it's working?
You mean on what we're doing at giving out more Narcan in the community?
The short-term solutions, when do you come back and say, is this working?
Well, yeah, the ultimate test is, of course, what the medical examiner shows us in terms of what deaths are doing. I think other data that shows us, it's harder to get to exactly, but the Harm Reduction Network, I think, said they saved over 500 lives by administering Narcan last year, which was an increase over the previous year. So I think for us, the real reckoning is when the medical examiner's data comes out next year to see if what the programs that we're doing this year are having an effect. I do think there are some programs that were put into effect, like this Commissioner's Court purchased a good amount of Narcan to give out to the community. Some of that, I'm hoping some of that was not reflected in the numbers of deaths that we saw for 2022. I'm hoping that that program will have had more time to take effect and will have saved more lives. But this kind of work that we're talking about doing with community care, the sooner that we can start doing those things, we're already, halfway through this year right now. And so there have been a lot of people dying that if we're able to implement these programs that community care is talking about, we'll be able to save lives. And that's why, frankly, we brought this data set out before it was complete. We still are trying to get more data from integral care and mental health providers, because to do that we have to have ILAs because of the laws about data in the state. But it's such a big problem in our community. The number of people dying is so high, and that we wanted to get this out and just start work as quickly as possible.
Any other questions? Over in the back.
Yes, sir.
What's the timelines and start implementing some of those solutions that community care was talking about?
You want to?
So a number of the components that I outlined here are ones that have been established as best practice. They require significant coordination between whichever healthcare provider takes on that role with the county and the sheriff's office as well. So that, as far as I'm aware, there is no established timeline, but this is the convening of the right members of that collaboration to help establish what are our goals and what timelines and objectives do we set.
I just wanted to go back to the question about what we're seeing in the data, and we've been convening a collaboration to look at data for over a year now, and the last meeting that we had most recently showed that we are seeing a decline in the numbers of calls out for overdoses, and that we're hoping that that trend will continue. So we'll continue to monitor that and keep you abreast of that.
Anybody else? Thank you all.
All right. Yep. Thanks y'all very much. And I do want to say that, had the legislature legalized fentanyl strips, that would also have helped with this. So I would call on the governor to maybe call another special session to work on legalizing fentanyl strips to address Commissioner Shea's point about funding this, because all of this takes money. The funding for community care and others, something that the state could really help us with. Thank y'all very much.